My name is Katie Bergen, and I'm 24 years old. And I have more of a comment for you, but you can respond however you feel. You say that the current healthcare situation is unsustainable, yet our current debt is $11 trillion and is growing. This administration is spending at a record rate, and you do not call that unsustainable? To me, it is unsustainable. And this health care bill that you are trying to push through is going to cost $1.6 trillion. And you called that a pilot. It seems like a pretty expensive pilot to me. And whose expense is that at? Mine. I'm 24 years old, and I'm going to be paying off this debt. And my children are going to be paying off this debt. And their grandchildren, and further on.
You're right. The issue of the debt and the deficit are extraordinary ones, and ones that we as a nation have to address seriously. A provision called statutory pay-go just passed the House of Representatives. It is a commitment that as we go forward, we pay for what we do, and that is very much a part of the discussion on health care reform. So that is why you have seen this abiding commitment from the House. You will see it from the Senate, and you will see it from our President, that we pay for what we are doing. Yes, we have made taken some extraordinary steps in the past year to address the great challenges in our economy. But history tells us that failure to do so would have been catastrophic to this country. And so it's an investment we have to make not only in the present and in the future, and as we work our way out of it, seriously address the long-term deficit and budget and deficit and debt challenges we have. But you cannot ignore the long-term cost on our economy if we fail to address the challenge of health care and the drain it presents to our economy. In 10 years, it will be $1 out of $5 spent, and that is what is unsustainable. And no, I didn't mean to suggest that this health care reform package is an experiment. There are pieces of it. For example, within Medicare, if you do pilot programs to test changing how we pay doctors, if those generate substantial savings and secure the kind of care that we've become accustomed to, then you expand it. But this health reform initiative in and of itself is designed to address serious challenges not to our economy as well as to the long-term well-being of every American. Thank you.
My name is Scott Richardson. I'm from Concord. You met me on my lawn when you were doing a walkabout, and my daughter recognizes you as a member of Congress.
How old was she then?
She was 2 then, 2 or 3. First of all, thank you for your service. Thank you for voting on the stimulus package. Thank you for being part of the progressive let's bring back our country movement. Couple quick things. When I was a student in London, I was served during the middle of the night in a not very good neighborhood of London by their national health system, and it was fabulous, and I was well taken care of. And I would hope that anyone in our country who was here as a student would have the possibility of having decent health care. So whether it's through a public option or co-op or whatever, let's just make sure all of our people are covered. Number 2, I'm a small business person. Because of the mandate in Massachusetts, my company chose to cover part-time employees with health insurance. So we now pay health insurance for our part-time employees. We're able to do that because of the connector, because we can get those good rates through Commonwealth Cares. So if there's a possibility of someone who doesn't have coverage today getting coverage through a government plan at a lower rate than would others be possible, They're going to get sick either way, so why not have them in an insurance program so they can get checkups, right? It's going to save money. We know that. Regarding healthcare, I never cared about healthcare until this go-round. I just didn't think about it. I had insurance. But I've come to appreciate now what President Obama, when he was candidate Obama, was talking about. The tactics and the disinformation and the Obama with a mustache and you getting yelled at town meetings, that's only going to get worse when we get into the next topic, which is going to be energy and cap and trade. My question is this. My question is this. Do you and the other progressives in Congress feel like you're getting support from your constituents to step up and pull off the fundamental change that's going to need to take place over the next 4, 6, 8, 10 years? Are you getting what you need from those of us who elected you? President Obama won the election. You won the election. Are you getting what you need from us to stand up to the information and the misinformation?
Well, I think we can use every voice at the table, generally speaking, on so many issues that we face as a country. As we've seen, this one has really engaged us in a way that probably we would not have thought possible when it was simply something that was out there as in the future kind of possibility with a new president, either President Obama or President McCain, both of whom embraced the need to address this. So it's clear that because it's so personal, it affects us so deeply in our lives. Yes, we've all had to stop and take a look at, one, how we get health insurance. I have even done that. You know, I mean, as I said, when I first won, I went off to the HR person. I took my insurance. I've been paying, the money's been coming out. It's only really in the past 6 months or so I've gone to really look at what is my piece, what is their piece, what is it covering, what does it mean, and what is important long-term to this country. I've also had some extraordinary experiences with healthcare in my life. You know, my husband had the opportunity to have life-saving treatments that gave him 13 years of life that he might not otherwise have had. I understand how important that kind of care is when we get sick. What we need to also focus on is keeping us well. And the reason fundamentally, we might go off forever and never have this discussion if we really weren't facing, how do we pay for it all? How do we pay for all of this? And that's the dynamic that we're really having to engage in, and I actually find it so, as a country, I think we should only be proud. Yes, we've had some pretty unbelievable town hall meetings across the country. That's some of it reflective of very passionately held beliefs, some of it reflective of very deep fears. A combination of what is the role of government? How am I going to be affected by all of these changes? And yet, we have to face this moment in time as to what are the decisions we make to shore up not only our lives, but our children's future. We will have that discussion again when it comes to addressing global warming and climate change and how best to deal with that. But what we can't afford anymore as a nation is to use our differences as an excuse to do nothing. So thank you. All the voices need to be at the table and with great respect for one another, but our beliefs should be to be heard. And we have about 15 minutes, so I know, just to alert those of you at the back of the line, you should have received a card on the packet of materials we gave. If we don't get to you, just if you would please write any question we haven't dealt with this evening, we will get back to you.
Hi, I'm Andy Johnson from Stowe. I have a friend who was a primary care physician. He retired early. Actually, he was under the, feeling a pinch from the insurance companies because he would typically take an hour to do a physical, and now the insurance companies say you can't take that long. But ultimately, when he retired, he did it for one reason, because he couldn't afford his malpractice insurance anymore. Why isn't this bill addressing the tort reform?
I said, it's obviously a very important issue. Malpractice, the issue of malpractice premiums is a great one. Defensive medicine, it is acknowledged, drives a lot, or at least a certain number of decision makings and perhaps some of the overuse of our system. I think one slice at that was, again, the comparative effectiveness research. It's a neutral database that people can go to, not even a database, but entity people can go to, that a physician can go to make a decision and use it or not resort to it or refer to it with his patient to say, you know, look, there's all this data that says I don't need to do X, Y, Z. We are all the same. As patients, we get sick. We go into the doctor's office. We want everything it takes to make sure that we're well, or at least so we know whatever's going on. But none of us have a place to refer to say, you know what, you really only need this. So to help deal with some of the costs, some of the decision-making that physicians make as defensively to protect themselves, that is the first crack at it. The need for malpractice reform, yes, is a great one, but it would generate a tremendous debate that I think there was a decision made to postpone it for another time. But you're heard and it's understood.
Because what we're going to end up with is this public option, which is going to be civil servants. You can't fire them, so that plan has to work, because even if it doesn't, they won't go away. The government's still going to be paying for it.
Well, but the public option is not, it's not delivering care. The public option is not delivering care. It's an insurance program, and physicians will say, as they do with Medicare, I want to be a Medicare provider. I want to provide care to seniors who are covered by Medicare. It will be the same mechanism.
Judy from Stowe, and I really have very mixed feelings about this insurance plan. I've spent the last 20 years of my life thinking about it because I had highly treatable cancer 20 years ago, which was, really fine for me because I didn't need much treatment and I knew I'd be fine, but it made me uninsurable unless we got insurance from my husband's company. And that was great all the years we got it. And it was cheap. It cost us, what, $100 a month, maybe $200 a month. I think people are happy with their employer care because they're not paying for it. When he retired before 65, our COBRA cost us $1,200 a month. Now, let's compare how much we pay. My husband's on Medicare. It costs him $2,400 a year. That's a pretty good deal because I am not yet eligible for Medicare through the Massachusetts connector. My cost is $12,500 that I'm paying myself. Now, we have spent our whole lives being frugal and saving for retirement. I don't see how long that's going to last at that cost. I want to see people covered. I want to see people have affordable insurance, but there's a line. Where is the affordability? And how do we as a nation provide some medical care for everyone, but yet have it be affordable and not bankrupt us? I don't hear anything in the bill that saves sufficient money. I really don't. I want to cover people, but I don't want us being bankrupt over it. And I have a personal interest in this.
Well, I do understand, and I think that the issue of providing coverage to most Americans, we won't get to all Americans, given some of the challenges associated with covering the cost of that, but that will be great strides forward. We will make great strides toward extending coverage to people. I think addressing the issue of what it might cost someone like you who has had a pre-existing condition will be addressed through some of these broader insurance reforms, so that your insurance premiums are more affordable. But long term, it is the underlying issue of the cost across the system that we really do have to grapple with as a nation. And it's dealt with in many different ways, whether it's just creating access, which creates creates management of chronic diseases where traditionally you're not cared for. If you end up in an emergency room, it's not so much the emergency room, but it's the fact that you wait till you're very sick and then you go to the emergency room because it's the only place you historically could go, then it costs the whole system a lot of money. If you don't take care of children, children don't have health insurance and they're not getting the kind of routine care as they age. They are not well adults, and it costs the whole system tremendous amounts of money. So you want to keep children well so they can learn and flourish, but you also know long term you want adults who can participate and contribute. It is a somewhat different dynamic, but trying to protect the good care you do get, and this country has always provided or tries to provide when people are very ill, particularly as we are here in Massachusetts, where we have access to some extraordinary facilities that do so much to sort of lead the nation in caregiving around serious illnesses.
That's true. I just want to say that my pre-existing condition does not in Massachusetts affect my premium. And so I'm paying that $12,500.
Hi, my name is Carrie Ann Wells, and I just want to thank you for coming today. I am in favor of the public option, but I'm a little concerned about how it's going to be administrated and funded. And I was hoping you could clarify, how do private carriers get involved in this public option? Are they renegotiating group plans with them, like our employers do, or are they out of the game completely and you've got a government entity? And I also want to ask you about the funding mechanism. You say it's going to be funded with premiums. I guess I'm just apprehensive that that's really going to be sufficient to pay for it. And I'm wondering how high you expect those premiums to be. Will there be other out-of-pocket expenses? Or maybe could we introduce some other sources of funding to supplement premiums?
Premiums will not be supplemented, and that's a standalone piece of this piece of legislation. Well, let's just say the public option is in the exchange. The exchange is really a mechanism where all private insurers can come into it, and the public option, if it's finally a piece of this legislation, is also in there as a choice. So the public option, the private insurers will put out their plans, the premiums associated with it, what they cover beyond the basic benefit package, and people can make that choice. Then you'll have the public option competing with all those private insurance companies. And if an individual says, I want the public option, they pay their premiums to the public option, and the public option spins out the money to cover their care as it is needed. So much is going to depend on the attractiveness of the public option, its ability to bring in providers. So we all know we have particular doctors we like. When we're making a choice of an insurance plan, we look to see, does it cover these doctors that I like? Does it cover that physician that I'm used to going to? And so one of the challenges to the public option will be attracting physicians who are willing to be paid through that mechanism. So it will take a while to get up and going. I mean, and in fact, this legislation, if passed, will not be put in place. It's going to take a number of years, till 2013, and even then you may see sort of an evolutionary dynamic to it. So the public option has a lot of challenges, and a lot of the features that initially were thought to give it more heft early on, such as having their reimbursement rates be similar to those as a Medicare, those that are given through Medicare, and creating incentives for physicians who currently are in the Medicare system, who are willing to provide treatment to seniors covered by Medicare, giving them an incentive to also provide care into the public option. Well, in the interest of leveling the playing field, that has kind of gone by the wayside. So the public option will have a real challenge, and it will take some time for it to generate sort of the confidence of the American people. And so we get the question, we had a piece of legislation that said every member of Congress should sign on to the public option. But the public option is meant to be a choice. It is not a mandate. It is a choice. And So we have to, as it goes forward, every effort will be made to make it a very viable and competitive one. Now, some of the things that the public option might do that a private insurance company might not be willing to do is look at ways to save administrative costs, so that in the end, they're able to pay for patients' care, but their premiums are less because their administrative costs are not as high. So it becomes an option for people who feel, yep, I've got the physicians in there I want. I feel comfortable that they are going to pay for all the care that I need, and they're that much less expensive because they have been innovative and tested different ways of streamlining their business. So that's one of the important features of having a public option as part of this overall mechanism.
The rates with carriers, it's going to be a government entity paying things.
It's going to be a government-run insurance plan, just as Medicare is a government-run insurance
like
plan. Yes, but Medicare is having a challenge, as will all these insurance companies, if we can't address the underlying issue of the cost of care. So employers will have issues, Medicare will have issues, Medicaid will have issues, the system of delivering and paying for the care that go to military personnel, all of it's a system-wide challenge that we face, which is why we can't deal with it piecemeal and have to deal with it in a holistic fashion. And I think I have time for one more question, so.
Hi. I tried to read the bill, and it's 1,000 some odd pages long. It references different paragraphs of different sections of different laws. Can you make something simple that somebody like me could read, a couple hundred pages, understand it, so we know what we're getting? Because I think we're getting screwed.
The other day I was asked if I could change one thing, what would it be? And in reality, the thing would be if we could make the bill as a whole. Some pieces of it are very clear, but when you're dealing with pre-existing legislation and you're tweaking different pieces of pre-existing legislation, that is where it gets to be very complicated. But I can tell you this, if you have a question about any piece of the bill that you have, because of the way in which it's drafted, we'd be happy to do the research you needed to answer your questions.
The thing in the entirety, and you can't look at this thing that says we're going to change this paragraph of this law here, or this paragraph here. You need to look at the thing in the entirety. It shouldn't include tort reform. It needs to be the whole package. We're spending 15th of the gross national product of this country on this, and we don't know what it is. And you don't. You have the power not to vote on it. Stand up, tell your leadership, I will not vote unless my people can understand it.
I'm sorry, we're done. Please submit your questions. I appreciate so much the very serious and civil discussion we've had. It's been, and I thank you so much for coming out. And as I said, if you haven't had a chance to ask your question, please submit it on a piece of paper. It may take us a bit to get back to you, but we will do that. And again, thank you so much, and I look forward to working with you.